I was homeless in a cardboard box because I want to get high. And I remember being like, I'm not doing this. Then the next day, I just want to get high all over again.
Every day it was the same thing. Wake up, get money, use till I had nothing left, wait for my dealer to get home, go buy more, repeat. And the whole time I just kept thinking, I'm not hurting anybody but myself.
I felt alone, I felt ashamed, I felt like there was no one I could talk to about my addiction.
The first night I was in treatment was the first time that I publicly raised my hand and said, I'm an alcoholic. And for most people that would be rock bottom. And I look at it now and I realized I'd hit rock bottom the day before. I was on my way back up. Recovery shouldn't be something that's just for the privileged in Oregon. It should be available to everyone because addiction knows no boundaries. Oregon Recovers is a coalition of treatment providers, drug and alcohol counselors, and recovery community leaders who are coming together to transform Oregon's fractured addiction recovery system into a continuum of care that treats addiction as a chronic disease. We kicked off Oregon Recovers with a big rally in downtown Portland, and it was the first time our coalition was coming together in a political advocacy way.
Oregon ranks 51st, dead last in the nation in providing access to treatment. Is that acceptable? No! That's why we created Oregon Recovers. Oregon Recovers believes that addiction is a public health issue, not a criminal justice issue.
That's right! This is what a social movement looks like, I think.
Addiction is a heavily stigmatized disease, and so our voices have been marginalized for a long time, and we want to change that.
At the age of 23, I was introduced to my first and only love, methamphetamine.
And it's not my will alone that has helped me to find recovery. It is the fact that I had access to treatment.
I've never been so proud to be a dope fiend in recovery than I am today.
At the rally, we asked everyone to bring a shoe representing someone they had lost to addiction.
This shoe's for my mother, and I want to recognize that even though my mother's gone, she's never forgotten, and I'm going to put it in the pile.
For me, each one of those shoes represented a preventable death because we know that addiction is a treatable and preventable illness. So the bottom line is none of those shoes needed to be there if we had a system that was adequate and addressed addiction in the way that it should.
Oregon Recovers is about empowering the recovery community to advocate for change within the prevention, treatment, and recovery systems across the state. Clackamas Bend, Southwest Portland.
Oregon has a huge addiction problem. We have one of the highest opioid misuse rates in the country. We have one of the highest youth incarceration rates, one of the highest foster care rates, and we know that addiction is driving all of that.
In the community mapping project, we're gathering stories to better understand the gaps in recovery and treatment services and how particular communities might be more impacted by addiction. We want to go to the folks who had to work the hardest to find the services in their own communities for solutions. I spent almost 10 years of my life being in addiction. When I became addicted to opiates, I just thought, okay, this doctor prescribed me this medication. I'm supposed to take it this many times a day. And at that time, I had 3 little kids, and I was going to school and working and being a mom and running a household, and I felt like it gave me the energy to do everything I needed to do. It got to the point where I was drug seeking through doctors. After that, I learned that you could shoot up pills. And so I came back with bruises all over my arms from trying to hit myself. It changed my chemical makeup. It changed who I was. I was not me anymore. Trying to find help, and I was calling places every day, and it was always, you're gonna have to wait. I called everything within a 300-mile radius and could get nothing.
Growing up, I remember all my friends were smoking crack. And I took a hit, and it was all over with. Went through every juvenile institution. Then once I hit 21, I started committing crimes till I got caught and ended up stuck in the prison system. Half of the time I'm in denial. Oh, it's not the drugs, it's not the drugs, but it is. I would get out and do the same thing over again and go back. There was nothing recovery orientated in prison that impacted me to get out and change. Point blank.
There are two questions that need to be answered. How do we reduce our addiction rate? And how do we increase our recovery rate? Prevention is the first step. Let's not get people addicted to begin with. And then intervention, how do we empower teachers? How do we empower parents? How do we empower employers to help people get into recovery in a way that isn't at the crisis moment?
We know that the vast majority of people who are in need of access to addiction treatment services don't receive them because they aren't available.
We're really interested in transforming the fractured system into a continuum of care so that the minute someone calls and says, I've got a problem with drugs or alcohol, there's immediate response. Just as if you called the emergency room and said, I'm having a heart attack, immediately the person on the phone takes responsibility for that.
It should be a system that's integrated. Someone should seamlessly move from treatment into supportive housing if they need it, or a direct connection with a mentor who will help them develop a recovery support plan, that they're not walking around in the dark, which is our current system.
Sometimes I say I got lucky. I got to a program quick and I was able to get those tools, but not everybody has access like that. Addiction is real. But with the right tools, people can get out of addiction and succeed. And we need to be able to provide what people need to succeed.
Our mandate is to transform the system. And so the first step is to look at the institutions making decisions around policy and programs. The Alcohol and Drug Policy Commission was empowered to design and implement policy, and yet for 10 years never has stepped up to the plate to do that.
Our strategy is to pull together all of our people and power and direct it towards political action. Something that is tangible, achievable, and has some teeth.
We reached out to the governor's office and began a conversation around an executive order that would elevate addiction as a political priority in the state. That led to Representative Tana Sanchez, a House member in North Portland who was also a woman in recovery for 40 years, creating House Bill 4137. The bill calls for the state to produce a comprehensive plan to address addiction by a specific date.
Members of the committee, I'm Tana Sanchez. I'm State Representative for House District 43, and I am here today about House Bill 4137. We're submitting a bill that will ask the Alcohol and Drug Policy Committee to actually do their job.
And Lobby Day was our chance to bring advocates from across the state together to meet with their senators and House representatives to talk about the importance of House Bill 4137 as well as the executive order.
It was bringing people that were in recovery to the Capitol, many of whom had never done this work before, meeting with their legislators and telling their personal stories about how they were challenged by this fractured system.
We're all here today representing Oregon Recovers.
I'm 2 months shy of 2 years clean today.
And we're here in support of the Sanchez bill.
A more comprehensive approach to treatment options.
Due to quick access to treatment, when I was ready to make the change and finish Portland State University.
Hopeful that they'll pass.
This is not an academic issue for me, a very personal one. Today's good, but we need to have you involved a lot more than that.
Lobby Day was energizing. It was exciting to see so many people coming out publicly and saying it shouldn't be this hard to save lives.
Long-term recovery gives me freedom to achieve any goal I want to achieve. So I'm sitting here today with 8.5 years clean, in school, working a good job, grateful for my life, raising my kid. And that's the cool thing, like, he doesn't ever have to see me loaded. That is the coolest thing.
Recovery to me means everything because I don't have to let what happened in the past determine what's going to happen in the future. I support Oregon Recovers because now there is a voice for families and children and parents who are suffering. It's not above us anymore. It's up to us.
It is absolutely urgent that we let people across the state of Oregon know that they are not alone in their own fight against addiction. Today, I'm very, very proud to be signing legislation and an executive order that does just that. I'm declaring addiction to be a public health crisis in Oregon.
House Bill 4137 passed, along with the governor signing the executive order.
If everyone in this room who's in recovery can raise their hand. Governor, these are the faces of the people that you are serving with your signature today on these bills.
For our first political action, I would say it's a huge success. I think from my perspective, it's just beginning, and there's still a lot of work to do.
If we all come together, I think that we can transform our system to really care for everyone who's impacted by this disease.
I invite everybody to be a part of what is truly a movement that is going to have very practical, very consequential, and very positive impacts on everybody in Oregon.
Creating transformational change is going to take all of us. So we need everyone who's been touched by this issue to get involved.
Join the recovery revolution!